Hi, and welcome to the Put Your Best Foot Forward Diabetes and Foot Health webinar. Before we begin, I would like to acknowledge the traditional custodians of the lands we are meeting today and pay my respects to elders past, present and emerging and Aboriginal people watching this webinar. My name's Giovanna and I work at Diabetes Victoria, and I'm joined by my colleagues Jane, Kate and Christina, who together will be hosting this webinar. If you are recently diagnosed or would like to know more information about the work that Diabetes Victoria does, please head to our website where you can find information on the programs, services and events we offer to people living with and affected by diabetes. You can also find information about the benefits of becoming a Diabetes Victoria member. The National Diabetes Services Scheme website is also a great place to go and find information on diabetes management, subsidised products, and you can call the NDSS helpline during 9 a.m. and 4:30 p.m. on 1300 136 588 and ask to speak with the diabetes nurse educator, dietitian, or our advocacy staff to answer any questions you may have. We are very pleased to be joined by Dr. Rajna Ogrin and Ken Mustafa, who will be presenting in this webinar. Dr. Rajna Ogrin will discuss why people have foot problems and what you can do to keep feet healthy. And Ken will discuss his experiences of feet health and living with diabetes. We're very pleased to introduce our first speaker, Dr. Rajna Ogrin, who is a Senior Research Fellow at the Bolton Clark Research Institute. She trained as a clinical podiatrist, but now works as a researcher, doing research that aims to improve the health and well-being of community members. A very big thank you to Dr. Rajna Ogrin for joining us today.
So I'm going to be talking about putting your best foot forward, foot health for people living with diabetes, and thank you for joining me. And we'll talk about why people with diabetes have foot problems and what you can do to keep your feet healthy. And so I thought to go over some terms, and the first and foremost terms are the corns and callus. Normal skin is actually nice and pink, and that's because there's only a very little thin layer of skin covering the blood vessels, muscles and fat. And that's what you can really see, the blood that's coming to the surface because of the thinness of the skin. Corns, they're caused by vertical pressure at one really local point, causing an area of thick skin in a small localized area. And callus is shear pressure or friction, causing a broader area of thick skin to develop, so that the skin comes up yellow as it's thicker and covers over the deeper pink tissues. And there's neuropathy, and that's damage to the nerves because of diabetes, usually because of the sugar levels going up and down quite a bit. Loss of protective sensation is where the skin in your feet can't really tell when it's being damaged, and that's where your skin starts to potentially actually lose its protective sensation. The skin can become dry, and so the skin can easily crack, and also there's reduced sweating. Muscles in the feet could start to become smaller, and that can cause changes in the way that the foot works and can increase the pressure in parts of the foot. Also, the feet can become really painful. Quite a number of people feel pins and needles or outright burning pain or sharp shooting pain. Speak with your GP if you feel numb or have pain. There are some medications that might help with managing the pain. It may be that you need to see a specialist. Your GP would know the best person that you could talk with about this. Sometimes the feeling in your feet might be due to the way that the bones and muscles align in your feet. Seeing a podiatrist to get a foot assessment, looking at what is called the biomechanics might help to find that out. Currently, there's no cure for neuropathy. To prevent it, the ideal way is to maintain your near normal blood glucose levels to stop the damage to the nerves from actually happening. And then there's peripheral arterial disease. So atherosclerosis is the build-up of material, a waxy, fatty tissue in the artery wall, and this can block the arteries, stopping the blood passing through. This occurs in the legs more in people with diabetes, and as it's in the legs, they call it peripheral arterial disease. And so that stops the blood getting to the feet. the best way to prevent it, it's just the same as preventing heart disease. So getting on top of your blood pressure management, lowering that bad cholesterol through eating foods that have high amounts of the good cholesterol and less bad cholesterol, but also taking some medications that can help to do that, and your GP can help with that. Not smoking is another way to stop peripheral arterial disease, and doing plenty of exercise to keep your legs moving and your blood pumping. And then a foot ulcer, and that's where the skin has broken through its two layers called the epidermis and dermis, and that can be through a knock, rubbing from shoes with a blister forming, or other ways, whatever way can make that skin break, and it exposes that deeper tissue, and that raises the risk of infection and the risk of that ulcer getting deeper, increasing the risk of not healing, and having a foot ulcer, it causes the highest risk of amputation. And an amputation is where part of the foot or the whole leg needs to be surgically removed. And it's usually caused by a non-healing foot ulcer where infection and poor blood flow, that is peripheral arterial disease, to the feet are the leading causes. And around 80% of amputations currently performed can be prevented. And so that's what we want to talk about now. Now, the international guidelines on preventing serious foot complications have actually been put together by the International Working Group on the Diabetic Foot. And there are 5 key elements to prevent foot ulcers in people with diabetes. And I'll touch on them now, but go over each in more detail. And the first thing is really finding out who is at risk of serious complications first and foremost. And if someone is at risk, inspect and examine their feet themselves, but also regular checks with healthcare providers to see if there are any problems that have developed. Then, of course, there's the education of people who have issues to actually ensure they know what needs to be done and how to pick up on problems, as well as their family and healthcare professionals, because not everybody knows the issues that happen with people with diabetes related to their foot problems. Another big one is wearing appropriate footwear regularly, and that means footwear that fits your feet without rubbing, and it protects your feet from scratches, stones, anything in the external environment. And then also treating any factors that have developed that lead to serious foot complications early. So firstly, as I said, you need to find out what your risk is for having serious foot complications, and the best way to do that is having a foot screen. And a lot of research has been done to identify who is at serious risk of foot complications. And I've listed those risk factors on the screen now. And so loss of protective sensation is a really big one. Having a foot deformity, so changes in the way the joints are sitting or the nails, which make it easier for the skin to rub open and cause damage. Also, the presence of peripheral arterial disease, a past history of a foot ulcer, a past history of an amputation, and having a current foot ulcer has the highest risk of developing really serious foot complications and going on to potentially have an amputation. So what does a screen look like? Well, any trained healthcare provider can do a foot screen. Usually a doctor, podiatrist or a diabetes educator are those that tend to do these in the community. You can ask your local GP to find a local podiatrist if you want a podiatrist, located in the White Pages, Community Health Service or the Australian Podiatry Association website. So the foot screen assesses whether you have a risk factor for serious foot complications. And so what do you need to know is going to happen for a foot screen? Well, first someone will ask you, have you had past foot issues, say a previous ulcer, or have you had an amputation in the past? They will get you to take your shoes and socks off so that they can have a look, and they'll check your feet. Is there any thick skin? Are there any issues with your nails? Is your foot structure normal, or are there bones that are sticking out a little bit more that might rub or might potentially cause problems? And they'll see if there are any issues that you need to be aware of. Then they'll check for that loss of protective sensation, and that can be assessed in a number of different ways. And on the screen you can see there's an actual little filament that is touching a toe, and that's called a Sims-Weinstein 10-gram monofilament, and that uses puts a certain amount of touch that is a pressure that you need to feel should your skin be about to break open. And that's why we check that loss of protective sensation using that filament. If you can feel that, then you're much more likely to be able to feel should you start forming a blister, should your skin be about to break open for any reason whatsoever. There's also, next to that picture, there was one with a little, looks like a vibration tuning fork that gets stuck onto the foot. And what they do is they tap that and it starts a vibration. And if you can feel that vibration, then your nerves are actually working really, really well. And that's another way that they can check if there's any damage. Also, they check for peripheral arterial disease, and the easiest way to do that is to feel for pulses in the feet, but there are more extensive tests that can also be done. So once the screen has been done, then this slide shows the risk level associated with the risk factors and the frequency of ongoing foot screening recommended based on what is found. And so you've got if you're at very low risk, that means that they found no loss of protective sensation and no peripheral arterial disease. So you need to do a foot screen once a year. Low risk means that there's a loss of protective sensation or the presence of peripheral arterial disease. So it's recommended that a foot screen is repeated every 6 or up to 12 months. If you're at moderate risk, that means that you've got 2 of those risk factors I'd outlined before. And again, and actually screening would be potentially done between 3 and 6 months. And if you're at high risk, then they found 2 risk factors and 1 or more of a past history of a foot ulcer or amputation, or end-stage kidney disease, which is another complication that happens with diabetes, but it increases the risk of having a complication in the feet. And so the recommended screening is every 1 to 3 months. If you have a current foot ulcer, and as I said before, that leads someone to be most at risk of having much more serious issues, and so that's where you would be managed within a clinic. That is a high-risk foot clinic where they would provide a care team to support you to be able to treat that, and an expert team would be needed. So, what to do once you know your risk for serious foot problems? So if you're at very low risk, then basically it's having an annual foot screen to make sure you continue to have great feet. So it's really about, if an issue does develop, seek help from a healthcare provider quickly. And also the practical things that everybody should really be doing to keep their feet healthy. And that's really about wearing shoes that fit and protect you from cuts and scratches or anything like that. And if something does happen where you have a cut, a blister, a scratch, anything like that, do some general first aid that anybody would do, and we'll talk about that a little bit later. And also keeping healthy through exercise and doing your best with your diabetes management. And then low and moderate risk. And so for Diabetes Victoria do have some great guides on foot care that you can use, and I'll go over them step at a time. But some key points that to start are first and foremost that the risk factors for the foot complications that you need to be managed that you've identified. If it's a loss of protective sensation or peripheral artery disease has been found, then a more comprehensive examination will be needed to find out about the issues and then what can be done to manage them. Your GP and or your podiatrist will guide you for this. The best thing that you can do is check your feet regularly. If there are cuts, scratches, red spots that don't go away, these need to be addressed. Seek help from a healthcare provider who has experience in managing foot problems in people with diabetes, and they will be able to help you as best they can. If you have thick skin or nails, regular management by a podiatrist will keep them in check. Footwear that fits your feet deep and wide enough and protects your feet from injury is really, really important. And we'll talk about these in more detail. Oh, and actually, sorry, there's an extra picture. And then my feet and diabetes. So this is a great booklet that Diabetes Victoria puts out, and this raises the need for really good education and information so that you can understand issues before they present. And that's the real aim. Prevention, stopping issues becoming serious so you can do your best to keep your feet healthy rather than having to manage an issue. So information that's useful for you is key, and that means learning how to recognise early signs of problems and be aware of what to do to stop those problems from becoming serious. So this is the inside of that booklet, and so I will be going through these, and it talks about diabetes in the feet and suggests 5 steps towards healthy feet. And so the first step is the caring for your feet, checking feet, protecting feet, being smoke-free and having your feet checked. And I'll go over these one at a time, and we've already covered having your feet checked by a healthcare provider, so I will go over the others. But I did actually want to know, now that I've got that hand little signal in there, how many of you, could you press on the yes hand up, which of you have had your feet checked before by a healthcare provider? Oh, it's going up. Oh, it's going up. It's lots. Okay. Well done, that's great news to hear. So I'll talk about what you can do to care for your feet, and it's really general care that everyone needs to follow to keep their skin healthy. And it doesn't mean that it's anything special for someone with diabetes. Anybody really does need to be doing this to keep their feet healthy. So the first thing is really simple: washing your feet daily, not using water that's too hot, and drying them carefully, especially between the toes. It's best to use soap-free wash, pH neutral, which is always labelled on those soap-free washes, as they don't strip the skin of the natural oils, because if you do have loss of protective sensation, what tends to happen is the skin does become drier and cracks a lot easier. So it's always good to try and keep your skin as nice and supple as possible. And this is where you want to use moisturisers to stop the skin from getting too dry, and again to avoid those cracks, but not between the toes, because that often retains that moisture. The best moisturisers to use are oil-based. They seal that moisture in, and again, it's in the ingredients of the label. The moisturisers that have that glycerin-based, so that's the sorbeline kind of moisturisers, they actually act to draw the water to itself. And so in a dry climate, the skin often loses more moisture than it will keep. So ideally, oil-based moisturisers are best in non-humid environments. Cutting the toenails to follow the shape of the toe is the best thing, not down the edges. It's more straightish across, but not leaving sharp edges, because that tends to catch on socks and it might tear the nail across. So filing rough edges will stop those nails from catching on edges and tearing. How many of you actually check your feet? So if you wanted to pop your hands up, how many of you actually check your own feet? Oh, it's more than how many have had their feet checked by a health professional, so that's great. All right. Well, you all know checking your feet is daily. Daily is important. You're already doing it, so that's fantastic news. And especially if you've got loss of protective sensation, because unfortunately you're not able to feel if there's a cut or a scratch or other damage. So you need to actually see whether there's any damage. So the big thing is, can you check your own feet? Can you see your feet? Can you reach your feet? You need to really stop and think about that, because if you can't do that yourself, you need to start thinking about, can someone help you do that? Because if you're not able to feel your feet, you need to be sure that you can see that your feet are healthy and that there aren't any problems fairly regularly, because you don't want to have something happen and you're not aware of it. You do need to perform daily foot inspection of the entire surface of both feet. And that means even between the toes, the sides, the bottom, the tips of the toes, because you want to be able to see everywhere whether there is any skin damage or if there's any other issues present that you need to actually do something about. If there is thick skin or corn or a callus, you do need to see a podiatrist. Avoid using those chemical agents or plasters that remove these corns, because unfortunately they're chemicals that eat away at the skin and can actually cause a lot of damage that you can't stop. And so it's really best to see someone who can remove that skin in a safe way. Have you developed a blister or a cut or a scratch? Is it only minor? Is it appropriate to do your own first aid? And we'll discuss that a little bit later. But have a think about what you need to do if there is some damage to your skin. But if a more serious problem develops, really seek your healthcare provider's input in what you need to do to be able to treat and manage that. And we'll discuss that a little bit more later. Have your feet examined regularly by a healthcare provider to check your foot health, as I described earlier, on a regular basis to make sure that things are going well and that you're on track to keep your feet healthy. So protecting your feet is really, really important, especially those who have a loss of protective sensation in the feet. Wearing footwear is important, and that footwear that rubs or causes more pressure, or walking barefoot are major causes of foot trauma that have previously led to serious foot problems in other people who have diabetes in the past. So it's an area that as a podiatrist, we are really, really keen on getting people into footwear that is less likely to cause damage and more likely to protect your feet. But if you do have a loss of protective sensation or other risk factors, it's all about preventing that skin damage. So as I said, avoiding walking barefoot is important, or avoiding just walking in socks or really thin-soled slippers, because it's, whether at home or outside, because it is so very easy to step on something and damage your skin without realising it. Your feet are a long way away from your head and your eyes, so it's very easy to knock, hit your foot on something, stand on something, and you won't even know you've done it. We recommend also wearing socks or stockings without seams or with the seams inside out, because that will stop rubbing. Also suggest avoid wearing socks that are really tight, especially at their top, as they can cause swelling or cut off the circulation. If you do happen to have problems with swelling in terms of your veins actually don't work as well, and so you do get swelling in the legs and you need to wear those compression stockings, speak with your foot care team about what's best for you and how to go about that. Another thing is we've just come out of winter, so avoid using any kind of heater or hot water bottle to warm the feet, especially people that do have that loss of protective sensation, because it's so easy to not feel that your skin is burning from too much heat. And we have many people that have actually had problems with burning of their feet as a result of this. So it's just really avoiding things that might damage the skin of your feet and cause more serious problems. Now, shoes is, as I said, the big area for us as podiatrists. And so what do you look for in a good shoe that protects your feet? And really, it's one that doesn't damage your skin and nails. And so what do you need to think about? Well, the inside length of the shoe should be between 1 and 2 centimetres longer than your foot, and should not be either too tight or too loose. So basically the internal width should equal the width of the foot at the widest part of the foot. If you've got bulging at the sides or the tops of the shoe, that means it's too tight. And if the shoe's too loose, then your foot can actually really swim, if you like, in the shoe and actually move about too much, and that might actually cause rubbing in and of itself. The height of the shoe, especially at the toes, it needs to actually be enough for those toes to not rub at the top. So you don't want to have any of that rubbing at the top of the toes. The seams need to be smooth on the inside. That will actually be touching your skin. So you want to avoid thick seams or uneven seams. And these can rub and actually damage your skin. And if you have that loss of protective sensation, you really won't feel it. And if your blood flow to your feet isn't great, so you have peripheral arterial disease, it doesn't take much pressure to break that skin open. So any seams can actually cause that damage. We also recommend that if you're getting new shoes, the fit should be checked when you're actually standing, and preferably later in the day, because your feet are often the largest, then you build up a little bit of swelling by that end of the day. So it's always good to get a pair of shoes at that time, because that's when your feet are the biggest. Now, if there's no footwear that you can just get off the shelf at any foot store, because it doesn't fit your foot properly, and that means if the fit is because your foot might not be quite the normal shape, or if you find that there are rednesses that don't go away, or corns and callus develop because of your shoes, then you probably need to actually get some special footwear and insoles, and you need to speak with a podiatrist about this. When you do go to put on your shoes, look and feel inside your shoes before you put them on. I know it sounds strange, but it's so easy for things to fall inside the shoe. And if you can't feel the sensation in your feet, you won't actually feel it when you put the shoe on. And so many people have developed sores from this actually happening. So I know it sounds a silly thing, but many things can fall in shoes, or there might be a little stone in the shoe that had been picked up, or even a little seed or something inside there that you might not realise. So always good to check inside, tip it inside out, and get out anything that might not expect to be in there. And then there's the first aid. So a simple cut or a scratch or any break in the skin can be managed as you would any skin damage. And really, if it's something that's just happened, stop. If there's any bleeding, just stop that bleeding and apply pressure using a clean material pad. Wash your hands, run that damaged area underwater just to clean the wound. If there's any dirt in there, just get that away. And pat it dry, ideally with a sterile gauze, which you can get from any pharmacy. And then you want to apply some antiseptic and cover that with a non-stick dressing. Again, you can get that from any pharmacy. And the antiseptic that you want to use something like an iodine-based cream or ointment. They're really good only because they tend to kill off many bacteria and other organisms that actually might cause infection. It should start healing fairly quickly, but if you notice that area is getting red or swollen, it's just not improving, you really do need to see a healthcare provider to actually get some advice. People with diabetes, unfortunately, what happens is that the body's ability to respond to infection is less. It takes longer to heal, and so what that means is that infection is much more possible. So any signs of infection that might be beginning, you really want to get on top of that really, really quickly. And so, the other thing that you do want to start seeing changes in your healing within 3 to 4 days. So you should start to see any minor scratch or anything like that getting better after that time. And if it's not, again, go seek help from a healthcare provider. Now, if you're at high risk of serious foot problems, you really need to look at your feet every day and inspect for any breaks in the skin. Is there any cuts, scratches, any skin issues? And seek help quickly if issues present. Regularly visit a podiatrist with experience in managing people who are at high risk of problems, and they can address any callus, corns, any other issues, so that we can keep on top of things and that there isn't damage that's caused by these issues. We actually want to remove that thicker skin, because what we find is that thick skin causes extra pressure on that soft tissue underneath, and so each step that you take actually causes more pressure on that soft tissue underneath and can actually cause sores underneath that thick skin to develop. And so it's always good to remove that thick skin so that we're not causing that extra pressure. And I was talking about visiting a healthcare provider or podiatrist experienced in managing people who are at high risk of foot problems. Your GP may know of one, and there are podiatrists throughout the community, and you can call around and ask, do they do diabetes foot assessments, just as I've gone through with you earlier? That is, do they have that 10-gram monofilament to check if you have protective sensation? Do they do a vascular screening? Do they know of a local high-risk foot clinic where you can get that expert help should there be a really serious foot problem and you need it? These will suggest that that podiatrist has worked with people with diabetes and would better understand what's needed to keep your feet healthy and to be able to deal with any problems that present to prevent them from becoming really serious. So when to seek urgent help? Well, really, this is before it gets to this point. All of these issues really need immediate attention by healthcare providers, likely a high-risk foot clinic. And these are located in major hospitals in metropolitan cities, and there are a few rural hospitals that also have some high-risk foot clinics. And these clinics have access to doctors, podiatrists, surgeons, and other specialists and expert team members to help you understand what's causing the problem and what they can work with you to manage these serious foot issues and hopefully help treat them and get you back on your feet. And if you don't know one of these, ask your GP or local podiatrist, and they should be able to direct you to them. But if you have any problems with your feet, really go and seek help by a healthcare professional, because we don't want you getting to the point where you have these serious problems. We want you to be able to identify things before that and actually get help so that you can actually keep your feet as healthy as you can. So up to 1 in 4 people with diabetes may develop a foot ulcer in their lives, and that actually means that around 3/4 or 75% may not. And so one of those, 1 in every 5 who develop a foot ulcer may go on to need an amputation, but that means 80% may not. So it's all about preventing problems from developing or getting serious, and that's what we were trying to talk about today. So remember, many people with diabetes don't have serious foot complications, and you can keep your feet healthy. And hopefully this has gone some way to help that. And certainly Diabetes Victoria have great information that can actually help you get more support in that way. But also you can see your local GP, your local podiatrist, your diabetes educator to provide you with information on this. So thank you very much for listening, and I've popped my email on there, so if you do have any questions and you want some more information, please don't hesitate to contact me. So we're now going to welcome our second speaker, Ken, who'll talk about his experience living with diabetes and foot health. Hello, thank you. Thank you so much, Ken, for coming in today.
Very welcome.
Thank you. So I just wanted to for you to tell us about how you found out about your diabetes.
I found out that I was diabetic. My brother's had thalassemia from when he was born. He's about 7 years younger than I am, and he had a new project running in Sydney where they could take the bone marrow from me and donate it to him, and hopefully get rid of the disease, and then his body could make blood again. And that's how I found out. After it was a successful transplant, they called me in, and they called me after all the tests that they'd done. They said, you're diabetic.
Oh, and how did you feel about that diagnosis?
It didn't really worry me at the time.
Yeah. So tell us about your treatments and your management of diabetes at that time.
They put me on metformin and told me to exercise more and have more healthier lifestyle, which I took on board, but I didn't really exercise enough and eat the right foods and stuff.
So when did you start noticing any problems with your feet?
Actually, before I even got diagnosed, I had sore feet and they were feeling funny all the time. Went to the doctor. They just said it was just rest them a little bit and you'll be fine.
And when did some more serious problems start to happen? How did that go?
Just aching feet was the main thing.
Mhm.
But then I started to feel lethargic. I used to get pimples on my,
Okay.
when I was 30 odd. I was still getting pimples and I couldn't work it out.
So what happened with treatments and so forth?
They just gave me the metformin. They upped the dosage. Gave me some antibiotics, that type of stuff, which helped a little bit, but still the underlying, never knew the underlying stuff.
An issue. And so then you kept having that tingling in your feet. And
Yep.
when did more serious problems with your feet start to develop?
When I was diagnosed, after I get diagnosed and I sort of had other problems, starting with my eyes, then I realised it was all the diabetes taking hold of me.
And so you started to have foot sores and ulcers.
Yeah, I actually burnt my foot on a radiator on a radiator heater.
Was it in winter?
I was in winter. I had up against the radiator, and I didn't realise it just burned.
See, people always laugh at me when I say don't do these things, and
No,
yeah.
right across all my toes and everything. They're all just blistered up. Took 6 months to heal.
So where did you go seek help?
The GP initially, and they sent me to the. I was in Sydney at the time, to Prince Alfred, I think, and they managed it for about 6 months.
Okay, and that healed over.
Yeah, it healed over.
Yeah. And so, what about the next time that something happened?
The next time I was back in Melbourne, I was living in Melbourne. I was working with my cousin actually, and we were moving some round tables, some poker tables, out of a truck. One slipped and fell on my foot, and broke my foot in 4 spots.
Oh my goodness. Okay. So what happened then?
That took 18 months to heal. I had to go to the high risk foot clinic in Maroondah, Maroondah Hospital, and every week had to get they put in a cask. Every week they broke the cask, and after it started to heal, I was in a moon boot for best part of 18 months, I think. Till it healed.
So that's a long time. How did that impact your life?
It wasn't too bad. But it was hard to sleep.
It's hard a bit.
It's hard to sleep.
And then what happened next? You had another problem.
The last problem I had with my feet was had an ulcer on my left-hand side, on my little toe.
Do you know how that formed?
Well, I don't know how it formed, but I believe I was wearing a pair of runners, and there might have been something small, like a little stone or twig or something was in there, and it rubbed up against it, and I made a hole in my toe, about 1 centimetre wide and about 1 centimetre deep.
Yeah, so it's something in your shoe, and that might have done that. So what happened with that?
That took ages to fix, because it was healing very, very slowly, and they didn't think it was going to heal because it was so deep that after about 8 weeks it was minimal healing.
Yeah.
So I was on dialysis by then.
Okay. Yeah.
I was really not doing. I was okay on dialysis, but I had to go on dialysis because my kidney function had gone so far down. I had to go on dialysis.
Yeah.
So they were thinking that I would have to amputate my toe.
Oh, and what were your thoughts at that time?
Well, it didn't really worry me, but at the end of the day, I was worried, but it wasn't going to impact much on me because I couldn't see my toe.
Because you couldn't see your toe.
Yeah, I couldn't see it. Well, I wouldn't be able to. I had socks on and shoes on. You wouldn't be able to see it, so it didn't really matter.
And you thought because it was a little toe?
Little toe, yeah.
Okay, but what happened? Because obviously,
it wasn't healing, so that's what they were discussing, amputating it, and then I must have done something else, and it got worse.
Oh gosh. Okay.
Right. So then they started treating it again. Had to start again, and slowly it started to come good, and all of a sudden just it cleared. But it took 8-9 months, I reckon.
God, that was a long time.
Yeah.
So what do you think helped get you over doing all of these things with your feet and having to go to all these appointments? And
Well, they were really, really excellent people at the podiatry. They were really good, you know. they upped my metformin, they upped my insulin, they upped everything, right? And my body slowly got on top of it. But, you know, if I had taken more care, it would have made all the difference.
Yeah. And so what do you do now just to keep your feet healthy?
Every 2 to 3 months I go to the podiatry. They check my feet to make sure I haven't missed anything. I try to look at them every day, getting out of the shower and stuff. But even when I was doing that, I still missed a hole on the side of my foot, in my toe. So I go there and they check it out for me, and they're really good. They cut the toes. It's really important for me, because if I nick it, I can't feel it, because I can't feel my feet. Even though my feet are there, but you can't. If you hit something, you can't. You don't feel it.
And I say people always think, oh, not feeling things, oh, that's not a problem.
No,
but it really...
But it is.
Yeah.
It is. That hole was like a centimetre round and a centimetre deep. Like it was just about to touch the bone. So it was a real wake-up call. Yeah.
No,
plus the other thing was, I was on the transplant list because I was on dialysis waiting for a kidney, and they took me off the transplant list. That was that was a real big wake-up call, because of that, because of not being careful of my feet, I could have missed a chance to get a kidney.
And what were your thoughts then?
Oh, I was angry. I was angry with everybody, because I'd made a mistake and it was impacting everything. You know, just took ages to get fixed, and then I finally got back on the transplant list.
So what do you want to tell others who have diabetes to learn from your experiences?
You've really got to check your eyes and your feet. And your feet, even though your feet are there, you know they're there, but you've got to check them all the time. Make sure you've got no cuts or bruising or holes in the holes. It's just really imperative, because it can, from a little hole, I was probably going to lose my toe. I was lucky not to lose my toe.
Yeah. Well, your toes are still here to tell the tale.
All 10 of them. I'm pretty lucky.
Yeah, so well done. And you had kidney transplants. So.
Yeah, I got lucky. Soon after I got back on the list, I got the magic phone call, and I got a kidney.
And so now you're regularly seeing the podiatry and keeping on top of things.
I see the podiatrist every 2 to 3 months, without fail.
Yeah,
because it's really important. Because at the end of the day, as we all know, if it gets out of hand, you lose a toe, a foot, maybe even a leg. Yeah, it's really, really, really important.
We've got some questions that people have been asking about. Do people with type 2 diabetes need to be as careful as those with type 1 diabetes? So what I'll say to that, it's really about the complications that have developed and the risk level for developing those foot complications. And so Ken talked about having that loss of protective sensation and not being able to feel that there was a problem, and that's the really big factor that people, that tends to lead to people not realising there's a problem, not seeking help and having issues. So it's not the type of diabetes that makes the risk, it's really about the development of those complications. But the problem with type 1 diabetes is that people tend to be a lot younger when they develop the type 1 diabetes, so they have diabetes for a longer period of time. And the longer you have diabetes, the more potential risk factors develop, and because they have more time to be able to work on your body. So it's really about those risk factors I spoke about as opposed to the actual type of diabetes. So the second question is, if medication is keeping your HbA1c under 7, do you need to be concerned? This is a tricky one because, and I don't know how many people are going to not be happy, because HbA1c is a test that you get every 3 or so months. So do you get that every?
I do.
Yeah. And so what we know is that it does show over 3 months, but usually it's the first 6 weeks of your average level of sugars in your blood. And what we know is that means it's an average. And so if your sugar levels go up and down quite a lot, then you might have a lot of lows and a lot of highs, but the average is still fairly okay. And so you might think you're doing a great job, but actually your sugars are actually going up and down, and that damages your nerves, and that can cause other complications as well. So it's not as simple as if your HbA1c is actually at the good level.
Right.
It's actually how consistently stable and low your HbA1c is. And so there are other things on the market now, the technologies that help you monitor your sugar levels over 24 hours, and you can actually see what they're doing. And that's becoming a lot more available now on the market to be able to see.
And cheaper.
Yeah, and cheaper.
That thing on your arm.
Yeah.
That's a really good one, but
Costs.
Costs are unbelievable.
Yeah, but there are things that, and they'll be able to better show what your management of your sugar levels are like, to give a better indication of the damage that might be happening as a result of those sugars moving up and down so much. And then 3, is it okay to have pedicures? So, and it's not because I'm a podiatrist, but it is much more about that infection control, because have a think about it. If you're using a nail file that has been used on someone else, there is a risk of actually getting tinea. There is a risk of passing on any bugs and things that someone else has had. So those are the kinds of things that as a podiatrist I think about. The other thing, and Ken, you were saying your nails in your toes are really thick and hard to cut, and so it's one of those things. It's very easy for them to crack then, and maybe crack in ways that might dig in a little bit more, or they might cut the nails so that they dig in a little bit further than they should, and so as they grow, it might actually cut into your skin as the nails get longer, and so it might not be, they might not leave your nails in a way that is most helpful. So it's just thinking about those kinds of things. If you've got great sensation, you don't have that loss of protective sensation, your blood flows 100%, you're not so worried about those infection things, it's up to you what you want to do. But as I said, I'm a bit finicky about such things, so I'd be a bit worried about those. I'm not sure, have you ever been to a pedicurist?
Actually, my ex-wife,
beauty therapist.
Had a beauty college, and that's one of the things I used to teach, pedicures, nails and pedicures.
Infection control?
Yeah, for sure. Yeah.
And so you just need to find out about that and go from there. And then what is the current advice for people with type 2 diabetes and ingrown toenail problems? I know they're really terrible. It hurts like mad. Have you ever had ingrown toenails?
No, I've been lucky with that.
Because I tell you, people cry in agony. So you can get them treated. And I'd heartily recommend, if they're a constant problem and making your life a misery, podiatrists, other people who go to someone who has regularly treats ingrown toenails, you can actually get the edge of the nail that is digging in removed, cut off, and actually there's a chemical that they can put down where that root of that nail grows, and that will stop that nail from regrowing. So you will never have that sharp edge growing again, and that means you're not going to have those problems again. But before I say that, you need to be sure that you don't have peripheral arterial disease. You need to have enough blood flow getting to your feet to heal that burn that is caused by killing off where that nail root grows. So that's just, again, it's one of those things that you need to think about in order to make sure that it's a safe thing to do. And as I said, going to someone that does those procedures a lot is the best thing, because some GPs can do them, various health professionals can do them, but if they don't do them regularly, it's like anything. The better you are at it the more that you do it, the better you are at it. So I heartily recommend that. And so, question for Ken. Do you wear special shoes, and which ones are they?
When I buy shoes, I've been wearing Skechers lately because they're nice and soft inside, but you've got to make sure that the back of them's really firm, so it holds your foot in correctly, and sort of you're not grabbing and trying to hold the foot. The foot's trying to hold the shoe in all the time. Yeah. So it's always try and buy a pair of shoes that are hard at the back there to support you.
I know the podiatrists Ken goes to, they've done a good job, because that's right, it's that firm heel that actually keeps that foot stable. So Alida will be proud.
Yeah. She's great, Alida. The whole team there is fantastic. Everyone should go to the podiatrist. They've got these community ones which really help the community, and they're not that overly expensive.
Exactly. So then there's Raina. Is there any evidence that a tight sock cuts off blood supply? Well, it actually, I'm not sure about if there's heaps of research about people causing blood flow being blocked off because of tight socks, but I do know that the swelling does tend to increase if the socks are tight, and it does dig into the skin, which then is more likely to then cause damage. And so it's one of these common sense things that we advise around that. So that's one of the things to think about. And someone says, I'm getting hot feet at night that often wakes me up. Is this related to diabetes or medication, for example, blood thinner? Well, it can be many things. There are many medications that do cause side effects that cause your feet to feel really, really hot. There are some things that it's called restless leg syndrome, where the feet move around a lot and you really feel like you can't keep them still, and that keeps people up at night as well. So it could be that the nerves might not be working well. The other thing that I mentioned before is sometimes if your foot, the way that the foot functions, so that the bones might not be hitting the ground in the most effective and efficient way, then it puts pressure in certain areas of the foot, and that then starts to damage the tissues inside the foot, so that when you're in bed at night and your feet are up and they're covered, then a whole bunch of blood rushes down there to try and heal up any of that little damage, and that can cause heat. So there are a lot of different things that might well be causing it. So I'd probably recommend speaking with your GP first if you're worried that it's about the medication. And the alternative is then seeing your podiatrist to actually look at if there's other things related to the foot that might well be contributing. But as I said, if you are taking medications already, it's always important to actually speak with your GP about interactions and things that might be contributing, but also to find out what causes that burning, because it might be something else. So it's always worthwhile just to actually get advice about that. And then another question is, if you participate in contact sports such as football, Aussie rules, and are prone to injuries from time to time, like bruised toenails and ankle rolls, can these things impact your foot problems or place you at a higher risk of developing issues? So bruising toenails, damaging your nails. The nails are a funny thing. They have the roots of the nails actually are at the base of the nail, and if you damage them too much, they can actually then cause your nails to grow thicker, or change the way that those nails grow. And then, of course, if you have really thick nails, or the nail is not in the right shape, then as that grows out, that can actually cause damage to the soft tissues down the track. So that's just something that might well happen. Ankle rolls or damage to your foot in any way. The ligaments can start to stretch, and you're more prone to actually get further ankle rolls and so forth. So that just increases your risk of falls and things. And what I raise that for is because when you don't have feeling in your feet, so you've got that loss of protective sensation, you're at high risk of falls, especially as you get older. Yeah. So that's one of the things to think about. But also, if you start damaging your foot in a way that might change the way your foot hits the ground, over time, your foot hits the ground a lot. Every step that you take, and imagine how many steps you take, that's a lot of pressure if your foot doesn't hit the ground as balanced as it should. And then all of a sudden that can change the way that your joints work and can actually cause arthritis, and then you get lumps and bumps that you didn't have before, which then can actually be areas of pressure, and then callus can form and things like that. But this is long-term things that might happen, so it's just but any damage to the foot can cause arthritis to set in, and can cause long-term changes that then increase pressure in certain areas. And if you don't have feeling in your feet, then that that then can be a potential cause of foot problems down the track. But seeking help by someone who can help your foot work better, getting the right shoes, checking if there's any issues and catching them early and seeking help early, and that's a really good way to go forward. And so Ken, you mentioned your podiatrists are great. What do you look for in a podiatrist?
Gee, the podiatrist at Carrington House at Box Hill, where I go, I don't see the same person twice. Like you get one, get the other, and then you get the next one, and they're all great. I don't know, they just go, because they give a great service, very friendly, easy to work with, and they get the job done. Mm-hmm. They're really good people. I don't actually look for anything, but just the community one's great because it only costs $11 to see them, so it's a really good value. Mm-hmm. So I advise everyone to go and, if they're especially diabetics, should go and get their feet done on a regular basis. Maybe once every 3 months. Mm-hmm. If you haven't got too many problems, mm-hmm. once every 3 months is probably pretty good.
Mm-hmm. And that's all the time we have to answer questions today. Thank you for listening to this webinar, and we'll pass it back to Giovanna to mention a few important points before we leave.
A very big thank you both to Raina and Ken for presenting today, and thank you to everyone who has watched this webinar. We hope this webinar has been useful to you, and if your question was unanswered, please give us a call on 1300 136 588 between 9 a.m. and 4:30 p.m. and ask to speak to a diabetes nurse educator or dietitian. Or if your question is specific to your own foot health, please see your doctor or podiatrist. Please keep an eye out for future webinars on the Diabetes Victoria website and the invitations you'll receive by email.